Good day. I am Dr. Shefali Tyagi. I am the obstetrician and gynecologist working at Birthright, Rainbow Children's Hospital, Sarjapura Road. On the eve of World Health Day, I really wanted to give you some information about the Gynaec Health. In pregnancy, majority of women will come and get checked periodically and thoroughly, but women do ignore their health when they are not pregnant. Gynae consultation is important for your menstrual irregularities as well as other problems which can happen. And one of the rising concerns we have is the rising incidences of gynecological cancers in women. The commonest cancers of gynae in women are the breast and the cervical cancer. In fact, breast cancer has become the most common cancer of women in India. So it is important to have periodic checkups to basically check out for these cancers. Now, how do you do that? So for breast cancer, basically self-examination is the most important part. Each lady should self-examine the breast. Once the periods are over, undress, stand in front of the mirror, see how the breast symmetry is, whether they are matching or not. And then with the flat of the hand, you can self-examine your breasts, right with left and left with right, to see if any lumps can be found. If no lumps are found, then fine, you can continue to do it month after month. But if you feel any lump or any thickness, tightness, which you didn't feel last time, you must get immediately checked by the doctor. Majority of lumps are picked up by women themselves. And apart from that, breast ultrasound and mammography are the two investigations which can actually pick up nicely that, any incidence of breast suspicion or something, and then we can always go with biopsy. For the cervical cancer, there is a test called pap smear. When the woman becomes sexually active, from that point till 60 years of age, she should get this pap smear done every 3 years. That is done by a gynecologist. It's a very simple examination. It's painless. It is just like an internal examination. And in that procedure, we generally take the cells from the mouth of the uterus, make a slide out of it, or take a liquid-based cytology and send it to the lab. The lab can tell us whether the cells are getting unhealthy and whether they need treatment or can they be just left alone. So these are the two ways the most important cancers can be screened for women. Apart from that, we have uterus and ovaries also as our reproductive organs. And for that, the screening of these cancers can be done by abdominal scans. So abdominal scans maybe every year can be done to see the thickness of the lining of uterus, whether ovaries, any cysts can be seen. And if you have a family history of either ovarian cancer or breast cancer or uterine cancer, then these screenings can be done more frequently. So it is extremely important that you get in touch with the gynecologist and do one annual gynae health checkup every year so that all these small problems can be picked up. Because like for cervical cancer or even for ovarian cancer, there are not many typical symptoms which warn us of the, that there could be problem. They can be silent cancers, and then the time they present, you could already be in stage 3, and then it becomes very difficult to treat these cancers. So if we pick up these problems early, the treatment is there and the facilities are there, so it can have a better outcome. So I hope that in this coming year, you're going to take care of your health. Go to the doctor regularly, get your gynae checkups done. And once you are healthy, you can ensure that your family as well as, the nation is also healthy. Thank you.